This is the Real Health Podcast brought to you by Riordan Clinic. Our mission is to bring you the latest information and top experts in functional and integrative medicine to help you make informed decisions on your path to real health.
Well, welcome everyone to another episode of the Real Health Podcast, and I'm your host, Dr. Ron Hunninghake, and it's my real pleasure today to have Dr. Michelle Niesley as my guest. And Michelle, welcome.
Thanks, Dr. Ron. I'm happy to be here.
And you're an Oregonian, right? You're out in Oregon?
That is correct. I'm in Eugene, Oregon right now, where it's actually quite sunny, which is nice.
Wow. We're kind of cold today. But anyway, we're talking to Michelle because Michelle is our new research director here at the Riordan Clinic, and we're very thrilled to have you aboard.
Thank you. I'm really excited for this opportunity.
So I wanted to kind of make this a little story of how did Dr. Niesley get to become this research director, maybe tie it in with some of the past research that the Riordan Clinic has engaged in to give our audience a perspective on just where we think we're going with research here at Riordan Clinic. But let's start with you. So you were telling me you when you were 15 years old, you won the World Series of women's softball or girls
softball?
Right,
a Little League softball.
Little League softball.
Michigan. Yes. So the team of 88 we were. So my little hometown of Tigard, Oregon, we actually were able to make it all the way through state and divisionals and regionals and win the World Series in Kalamazoo, Michigan.
Yes. And so that's why there was a number of reasons why we're really thrilled that you have come aboard with us, but that was one that I like to have people on the team that play to win. So here at Riordan Clinic, that's where we're shooting for. So anyway, so you went to naturopathic school. You're a naturopath. So tell a little bit to our audience, what does that degree mean?
Right. So that degree means that I did some training for the first couple of years that was very similar to regular medical school, but our expertise is really in nutritional biochemistry, in herbal medicine, botanical medicine, in homeopathy, exercise physiology, counseling. So it's really well suited for an outpatient primary care physician. And I happened to specialize in oncology and completed an integrative oncology-based residency. But honestly, getting into naturopathic medicine was completely by accident. I had planned on becoming an occupational therapist, physical therapist, and I took a year off after I graduated from college and happened to run into a colleague of mine on the streets of Portland, Oregon, and asked him what he was doing. And he said he was a student at National College at that time of naturopathic medicine and invited me to come for a student for a day. And I remember making a comment of, oh, great, so you're dancing around cauldrons and lightning storms. That's great. Because I really, even though I grew up in Portland and naturopathic physicians are licensed as primary care providers here, I had no understanding whatsoever of what an ND was. So I went to student for a day, and they were quite good about presenting cases. And what I realized is that it was really taking a diagnosis, which is really just a constellation of symptoms, and really trying to get at the root cause. So different people in front of you with the same diagnosis, their fix might be three completely different things for three different patients. And it was really that medical detective work that sold me on becoming an ND.
Yeah. We have the 7 precepts of the Riordan approach, and one of them is the healing power of nature. And someone said, you stole that from the naturopaths, didn't you? And I said, no, I didn't know. Much of what naturopathic medicine is, just as you've described it, that's what we try to do here at the Riordan Clinic. Now, here's the next big question. So you said that you were interested in cancer, and that played into some of your next steps. And so tell us a little bit about how that came about.
Sure. So while I was at Bastyr University in Seattle, I ended a lot of my internships were actually in HIV. So I was studying the immune system. And from a cancer perspective now, we all realize how important the immune system obviously is in the development of cancer and helping to keep people in remission or cure. And so I ended up interviewing for the residency that was held in Zion, Illinois at the time at Cancer Treatment Centers of America at Midwestern Regional Medical Center. And they had 2 positions available every year, and I was fortunate enough to get one. So in 2001, I moved to Chicago, a city I'd never been to before, and began a 2-year integrative medicine residency. I think the benefit of that is that we were embedded in the hospital. It was an inpatient training. So we were in teams that had a medical oncologist, a nutritionist, a nurse care manager, really this nice, wonderful patient care team. And it was a really wonderful learning experience, being able to go down and spend some time in radiation oncology, being able to see some patients with some surgeons, spend time with the pathologist, watching as the imaging was being done and watching the read of the CT scan or the interpretation of the MRI. And it really emphasized the need for clear communication with my conventional medical provider team that I was with. But the thing that I also realized was how important studies were and being able to provide any kind of evidence-based medication information for either herbs that we were using, vitamins that we wanted to use, anything. If I could bring an evidence-based study to the table, that was always something that just elevated the game plan, right?
Yeah, and so this actually, I can see how this led you into the whole integrative oncology area. So integration. So did you feel like you were better accepted as a naturopath? Because naturopaths have kind of had to find their way into the medical paradigm. And this is the way. The basis is in science, but it's not so much either or, it's a both and proposition. So how did that play out in your experience?
Yeah, I think that my training was, honestly, it couldn't have been any better because I was in a setting where I didn't have to fight for validity. I think the thing that I've realized once I've gotten out into other settings is that, again, I'm constantly doing education of not only patients, but of other healthcare providers as to what exactly a naturopathic doctor is, what we specialize in. I didn't realize how much public relations was going to be involved in my naturopathic degree, but it really is education. It's a constant education. And there wasn't genomic assessment, for example, when I graduated in 2001. So we've had to bring some of those functional medicine modalities more into the spotlight with some of the things that we're doing in integrative oncology, which has required additional education.
So you're not just an integrative oncologist, you're a board certified integrative. What are some of the additional requirements to be board certified?
Yeah, so I believe there's approximately 140 of us anywhere in the world right now. And I know Riordan.
Small number, yeah. And
small number.
We've got 3. So we value this. But tell our audience what that really means in terms of the validity that it brings to your status.
Right. It really, the way that I would verbalize it is that it really means that we have spent a significant amount of time. You either have to have completed an integrative oncology residency or demonstrated significant amount of patient interaction in an integrative oncology setting. There is a board exam that you have to pass. It renews every 10 years. And so it's a certification, that we need to attend conferences with our peers. A lot of us also attend ASCO or Society for Integrative Oncology or, the San Antonio Breast Conference. I mean, there's a lot of us that are attending some of the standard conventional conferences where we're learning more about integrative therapies that are being studied at some of the academic medical institutions. But it really means that our focus is someone can walk in and we understand what a certain diagnosis means, what that stage means. We already have an idea of what the potential treatment is going to be. We already have an idea of what recommendations we may make. For example, if someone's going to be getting a taxane chemotherapy, there's multiple studies showing that the amino acid L-glutamine can help prevent neuropathy, which is that numbness and tingling in the fingers or toes. And so amino acids are like little bricks. If you think of a protein as a big brick house, an amino acid is a small brick. And so it's easy to get L-glutamine in supplementation form in order to help patients prevent certain side effects associated with standard treatment. So those are things that FAB knows just off the top of our head. We know those studies. We know how to work with that patient walking in the door. We don't have to we're constantly researching and constantly staying up on the latest research, but there's a lot of knowledge base that we have just as the patient walks in the room. We already understand a lot about what they're potentially going through.
So we left you in Chicago. Where did your path take you from there?
Yeah, so this is a long path. I hope we have time. So I finished my residency in Chicago. I worked for a year at Children's Memorial Hospital and began a biostatistics program at Northwestern while I was there, and had the good fortune to have a research director at the time that had come from the PhD program at Dartmouth. So I was able to transfer my degree to Dartmouth, my studies to Dartmouth, and finished a master's in evaluative clinical sciences in 2005. The emphasis of that is biostatistics and epidemiology, which, most physicians, when they read a method section of a paper, it's really about how the cookie was made, right? How the study was done, what dose of a medication or an herb was used, how long patients were in the study, really what the intervention was, and then what the results are. Because if your cookie is not made well, it's not going to taste good, right?
And it will crumble.
It is. It's going to crumble. It's going to be hard. It's going to be underbaked, right? Mm-hmm. So we want the research to be done appropriately. And like I said, at CTCA, I really learned how important it was to be able to speak the language of biostatistics with my colleagues, because they were constantly discussing Kaplan-Meier curves and going above and beyond p-values and odds ratios and all these other statistical terms that most people shy away from. I really wanted to get in there and have a very deep understanding, really so that I could assist with writing of protocols, designing of protocols, again, to making that recipe something that was going to produce a good cookie, and also be able to answer some of the criticisms that sometimes were done of integrative medicine studies. Sometimes those studies would be done, an incorrect plant would be used, an incorrect dose would be used, it wouldn't really replicate what we would do in real life. And so being able to answer some of the constructive criticism when maybe some of the integrative studies weren't producing the results that all of us anticipated. So that program was a year. And then after that, I ended up going to the Raby Institute for Integrative Medicine at Northwestern. It was associated at the time with the Northwestern Memorial Physicians Group. So I spent a few years in Chicago with the wonderful and very innovative Dr. Terry Raby, who's a phenomenal individual. And then I decided I needed some adventure. And so in 2007 through 2009, for about 18 months, I was a primary care physician in Alaska.
Wow.
So I went to Alaska. There was actually a FABNO up there at the time who took a leave of absence. And so I stepped in and got to do half internal medicine or half family practice and half integrative oncology. And it was a wonderful experience, a really wonderful experience.
Yeah.
Came back to Northwestern. And then after that, shortly after I came back to Chicago, I ended up going back to Cancer Treatment Centers of America, this time in the Philadelphia location. And after being there for a couple of years as an ND, I became their clinical director of research.
Wow. So all of this has prepared you for landing in the Riordan Clinic, where we have done a lot of research. The RECNAC program, which is cancer spelled backward, was initiated by Dr. Riordan in 1990, and it was a full 10-year program. And we had 3 NIH researchers here full-time during that time, and we published a lot of information on the biostatistics of intravenous vitamin C, and we created a protocol for how to use intravenous vitamin C in cancer care. So as I listen to you, it's like, oh my gosh, you're like made for this next step that we're taking here at the Riordan Clinic, because during the pandemic, our research stopped. And so we're in the process of resuscitating the research here. And so we're looking for someone who had good clinical experience, someone who had a strong background in cancer. I did not know you were so strong in biostatistics. Of course, I was finding that out in our last few group appointments together. And so anyway, this is exciting. So how did you first hear about the Riordan Clinic, and how did this kind of come up on your radar?
Yeah, so I actually so Riordan has obviously a fantastic reputation as really being the birthplace of intravenous vitamin C, right? And so I have been exposed to intravenous vitamin C and some of the protocols that were developed at the Riordan Clinic even during my naturopathic education. We were exposed to some of this information and some of the studies. At Cancer Treatment Centers of America, when I was in Philadelphia, we did some high-dose IV vitamin C studies while we were there. It was really, my job there was fantastic because I was able to take some of the money that we got from doing industry studies, right? Standard pharmaceutical studies. And if we had some money left over, I was able to assist with investigator-initiated studies. And so writing those protocols and getting them through the IRB and studying what our physicians and providers wanted to study was really great. So it's always been a huge interest of mine to really facilitate integrative medicine research. And so I actually was contacted by one of your current physicians, Dr. Kirsten West, right? She was a resident of ours when both Dr. Stacy Dunn, who's also with you now, and I were working at that Philadelphia CTCA site. And so we heard about the opening, and Dr. Dunn interviewed for the opening and obviously has joined your staff, which is fantastic. But I was able to have a further conversation with Riordan, just knowing the history, knowing the background and how rooted Riordan is in research. It was very attractive to me to be able to land in a place where yes, clinical care is incredibly important in getting those patient outcomes, but really being in a place that was designed to produce data to really further educate other integrative providers on innovative intravenous therapies.
Yeah, our whole reason for being is based upon research, education, and innovative care as well. And so we're extremely happy to have three very well-educated and devoted FABNOs. Could you explain that term to everyone? You're a fellow.
A fellow of the American Board of Naturopathic Oncology. So again, that's the board certification in integrative oncology that, again, only approximately 140 of us have.
So I think we have a kind of dream team right now working here at Riordan Clinic. And so could you give us a little idea of what work we've started with? You and I have obviously talked about it before. Our audience, what are you doing now as part of the early stages of the research project?
Yeah, that's a great question. So there's a lot cooking in the background, but the project that we're working on currently is actually a foundational safety study in the oncology setting, also with other types of chronic diseases that patients may be receiving some IV vitamin C for, but especially in the oncology setting, very high doses of vitamin C are used intravenously. So 25,000 milligrams or 25 grams, 50,000, 75,000, sometimes 100,000 and beyond. And most of us in clinical practice have seen some slight alterations in lab values. So if somebody gets an IV today, they go to see their oncologist tomorrow to potentially receive their next dose of chemotherapy. Sometimes we'd see some changes in the kidney labs, or we would see some changes in the blood sugar labs that a lot of us in clinical practice are used to. And we just have acknowledged that often IV vitamin C can maybe cause minor shifts in certain lab values, but then return to normal within a short amount of time. However, as we were digging into the research more, there's no study that really documents this. So we're going to be, the protocol is almost complete, and there's been wonderful feedback from the whole Riordan team. It's really been a team effort. And so we are going to be using healthy volunteers who are going to initially be receiving a 25,000 milligram IV vitamin C formulation. And then they will be randomized to either receive a 50,000 milligram IV about 10 to 14 days later, or a 75,000 milligram IV vitamin C. And again, we're going to be looking for changes in complete blood count, a CBC, so that's red blood cells or white blood cells. We're going to be looking for metabolic panel changes, so that's liver and kidney function, blood glucose, and a few inflammatory parameters as well. So we're going to be drawing blood at several different times, right after the IV, a couple hours after the IV, and then within 24 and 48 hours after the IV, just to watch, if there are alterations in certain labs, how do those things change over a 48-hour period? So it's really foundational research so that we can set that baseline or that benchmark. It'll make it much easier for us to communicate with our conventional oncology colleagues, to be able to point to a reference to say, hey, that slight alteration in this lab is to be expected and should resolve within 24 hours. If it doesn't, then maybe we need to look a little bit deeper. But we don't want our patients undergoing either treatment alterations or treatment delays, conventional treatment delays or changes because of any kind of lab alterations that may be occurring due to high dose vitamin C. So we want to get that answer and be able to provide that to physicians.
I totally agree. Where do you think the bridge between conventional oncology and naturopathic oncology, the integration, where are we going to meet looking down the road? I know that's kind of a broad question, but in your efforts here at the Riordan Clinic as a researcher, what are some of the topics we need to be thinking about?
It's a great question. I'd almost toss that question back to you as well.
We'll be doing this together, by the way.
Yes, of course. Again, from an integrative research perspective, I really feel like being able to obtain additional referrals for high-dose vitamin C treatment for providers that work in integrative clinics, being able to show we're also collecting quality of life data with that safety study as well. And so really being able to be very clear about what the indications are for high-dose vitamin C, what to expect, obviously, with lab values, what you may experience from a quality of life perspective. I think being able to open access for patients for whom this service is appropriate, I think is really important. A lot of standard oncologists do not have the time to stay up on all of the integrative oncology therapies out there because there's a lot, and it's a full-time job for those of us in integrative oncology to stay up on it, which is why I've always been a large proponent of the team approach and have usually worked in concert with surgeons, radiation oncologists, medical oncologists to show that conventional therapy is obviously incredibly important, but there's so much that we can do to support the whole person to reduce side effects and hopefully also reduce risk of recurrence. So I really feel like some of these foundational studies and moving forward, with our research agenda at the Riordan Clinic is really going to help solidify high-dose vitamin C as a therapy that is beneficial in multiple situations, can be administered safely, and be able to really clarify what the benefits are.
I think if we can show that it's a valuable adjunctive therapy that will help give patients better outcomes, better quality of life, and a way forward in their own lives to where they feel hopeful that they can indeed survive one of the greatest challenges in a person's life, which is, you've got cancer. We're trying to create a really strong foundation for what we do here so that we can get more and more people to better results, basically. Mm-hmm. So
yeah, and I really, IV vitamin C and other integrative therapies,
it's a bunch of them.
Yeah, there's a bunch of them, but I really think that one of the benefits, especially when working with conventional oncologists is that it's very empowering. It is something that the patient can do at home or when they're not receiving treatment. Again, it's something that treats the whole person and really can really give patients hope. And I think, that's so important. I think a cancer diagnosis sometimes can be obviously very challenging and very defeating for some patients. And when it's like, hey, yes, conventional therapy needs to be a part of your plan, but you know what else we can do? Like, while that's working on the tumor, here are the things that we can build you up with, right? And the things that we can do to help prevent side effects. And again, hopefully get you into remission and maintain that remission long-term, right?
We have a sign out front where we have a winding road that leads up to the domes, and it's all about health, hope, and healing. And I think with your joining the team, I feel like we've got a really solid foundation here to advance the cause of IV vitamin C in the care of complex chronic illness and especially cancer. So, Dr. Niesley, thank you so much. I'm very thrilled that you're on board the team, and we're looking for great things as under your leadership of the research. So thank you.
Thank you very much, Dr. Ron. I'm very excited to be here.
Thank you for listening to the Real Health Podcast. If you enjoyed this episode, be sure to subscribe and leave us a review. You can also find all of the episodes and show notes over at realhealthpodcast.org. Also, be sure to visit riordanclinic.org, where you will find hundreds of videos and articles to help you create your own version of real health.